Have you ever wondered why tuberculosis, a disease known to mankind for thousands of years, is still a major global health concern today? Indeed, tuberculosis, or TB as it's commonly known, has left its mark throughout history, from ancient mummies to the modern era. Despite medical advancements, this relentless disease continues to affect millions across the globe. The culprit? A resilient bacterium called Mycobacterium tuberculosis. But why is it so persistent? Let's delve into the world of this resilient bacterium and uncover the mystery of tuberculosis. Beware, TB is an airborne disease. It spreads when an infected person talks, coughs, or sneezes. These microscopic droplets released into the air hold the bacteria that cause TB. Anyone within close proximity can inhale these droplets, potentially welcoming the bacteria into their lungs. Picture a crowded bus, a bustling office, or a cozy living room. These are places where TB can find new hosts. It's important to remember, though, that TB isn't as easily spread as the common cold or flu. It usually requires close and prolonged contact with an infected person. So, if you just pass someone with TB on the street, you're unlikely to contract the disease. But if you live with someone who has TB or spend a lot of time around them, your risk significantly increases. This sneaky and persistent bacterium is a master of travel and survival. Now that we know how TB spreads, let's identify its signs and symptoms. Coughing for more than 3 weeks? It might be more than just a common cold. Tuberculosis, or TB, often starts subtly, with symptoms that might be easily brushed off. A persistent cough, one that lasts for 3 weeks or more, is often the first sign. But TB doesn't stop there. Fatigue can set in, that bone-deep tiredness that isn't alleviated with rest. The disease can cause weight loss, even when your appetite hasn't changed. A fever might spike, often accompanied by chills and night sweats. And remember, while TB primarily targets the lungs, it's not confined to it. The bacteria can travel through your bloodstream, affecting other parts of the body, from the kidneys to the spine, and even the brain. TB is a master of disguise, often hiding behind symptoms that mimic other conditions. Recognizing these signs is crucial, but how do we confirm a TB diagnosis? It's time to play detective and confirm our suspicion of TB. The first line of investigation often involves a tuberculin skin test or a blood test. These tests measure your immune system's response to the bacteria that causes TB. They're like the scouts, giving us the first hint of whether TB bacteria may be at play. But to build a stronger case, we don't just stop there. Imaging tests, such as chest X-rays, can provide a glimpse into your lungs. They're like a bird's eye view, showing us if the TB bacteria have caused any changes or damage. However, the gold standard in TB diagnosis is microbiological studies, especially sputum culture and smear. Think of these as our detectives under the microscope, directly identifying and studying the TB bacteria. With these tests combined, we can confidently confirm a TB diagnosis. But the journey doesn't end here. Diagnosis confirmed, what's next? Let's talk about treatment. Treating TB is a marathon, not a sprint. It's a journey that requires persistence and patience. The standard treatment for tuberculosis involves a cocktail of antibiotics taken over a period of 6 to 9 months. This regimen typically includes drugs like isoniazid, rifampin, ethambutol, and pyrazinamide. However, it's not enough to simply prescribe these medications. Adherence to the treatment plan is crucial. If patients discontinue their medication prematurely, they risk developing drug-resistant strains of TB, a far more dangerous and difficult to treat variant of the disease. Now let's talk about potential complications of TB. In some cases, the bacteria can spread from the lungs to other parts of the body, causing a variety of problems. For instance, spinal pain may indicate Pott's disease, a form of TB that affects the spine. Joint damage could also be a sign of skeletal TB. Prevention, as they say, is better than cure. Vaccination with the BCG vaccine is a key strategy in countries with high prevalence of TB. It's especially given to children who have a higher risk of severe TB. But prevention goes beyond medical intervention. Improving living conditions, ensuring good ventilation and sunlight in homes, and educating communities about the disease can significantly reduce the spread of TB. Understanding TB is the key to its defeat. Together, we can make TB a thing of the past. Remember, every step we take towards understanding and fighting this disease brings us closer to a world free from the shadow of TB. So, what have we learned about tuberculosis today? Tuberculosis, or TB, is a contagious bacterial infection. It spreads through the air, manifesting with symptoms like cough, fever, and weight loss. Diagnosis involves tests such as chest X-rays and sputum culture. Treatment includes a long-term course of antibiotics, but complications can arise if not managed properly. The best prevention is early detection and vaccination. With knowledge comes power, and with power comes the ability to change. Stay informed, stay healthy.